Hi, I'm Dr. Norman Swan. I'm a physician and journalist based at the ABC. I co-host Coronacast and the Radio National's Health Report. My work is about broadcasting to the general audience in Australia, both about COVID-19, that's through Coronacast, and general health and well-being through the Health Report. And covering both those areas intersects with primary and secondary prevention and social factors that determine your health. What I'm passionate about is people having agency in their lives and the ability to make the right decisions about their lives, unimpeded by the system shifting them in a certain direction, which is a bad direction to go in. That's what I care about. And obesity is just one of those things. Well, clearly there's a strategy now for moving forward with an emphasis on children, and that's where it has to be. So that's really positive, and it's probably more than many other states have. We've got to differentiate between life expectancy, which is a population average about groups of people, versus lifespan. Most of us are interested in lifespan, how long we'll live as individuals. Now with life expectancy, because it's an average, it hides lots of important detail. So the life expectancy gap in Australia at its maximum between the longest lived suburb and the shortest lived is actually 45 years. It's not 11 years. So that's what happens when you uncover the average to get down to the detail. And it's going to be the same with obesity, is that kids growing up in rich suburbs in Queensland, like Indooroopilly or Ascot or Hamilton, a baby born today will live to 100, not 83, but 100. But you won't if you grow up in Bundaberg, Mount Isa, or a regional or rural Aboriginal community. So these things hide the important detail. Obesity doesn't sit by itself. It sits alongside other problems in the community, such as climate change, lack of transport, poor housing, the social and economic factors that determine our well-being. And it also is about the market. We tend to have a belief that the market works and can solve all problems. Well, the market doesn't work. The market has failed. If the market works, we wouldn't be obese. If the market works, we would have universal childcare. If the market works, we'd have no problems in education. The market doesn't work. And when the market doesn't work, the role is for government. This is not about personal responsibility. This is not a problem of personal responsibility or weak individuals. This is a problem of weakness of politicians to act, because it's only going to be solved by better regulation, more intelligent taxation, and action by government, particularly at the federal level. The one thing that people can do to make a difference in the obesity pandemic is lobby your state MP and your federal MP as to ask them why they're not regulating this area. And it's not just about food and the food supply and food pricing. It's also about rules for footpaths on pavements when you build a road. It's also about exercise spaces in town planning. It's also about cost of transport. It's also about universal childcare. Because if we had universal childcare and universal early childhood education, children would be set on the right path. We've got a different approach and attitude towards early childcare than we do from public schooling. Nobody questions public investment in schooling beyond the age of 5. Why do we question it before that, when we could have a big impact on their diet? I'm not optimistic about very much in this area, apart from the fact that we're getting a strategy, there's data on the table, and there's a call to action. If we don't want our children to have a reduced life expectancy of 4 or 5 years, we've got to act. And that's a really positive thing. It's kind of negative, but it's a positive thing that it drives change.